Great. Well, welcome back, everyone. If you didn't know me, my name is Summer Nasser. I'm spearheading our Health Services Research Journal Club, and thank you guys for all attending. I just want to put out a quick reminder that the Health Services Research online course is open October 20th through the 30th if you want to register. And it's an 8-week course. It closes December 19th. So I wanted to introduce our speaker today. We would like to welcome Dr. Janice Blanchard. She is the professor and chief of health policy section, Department of Emergency Medicine at the George Washington University. So originally she's from the south side of Chicago where her family still resides. Dr. Blanchard completed her MD from the Harvard Medical School and her PhD in health services research from the Rand Graduate School. She is a mixed methods health services researcher and has worked on a number of projects related to racial disparities in medicine. Her research interests are how health policy intersects with medicine, behavioral health, and racial disparities. She has written extensively on how COVID highlighted the role of social determinants of health contributing to racial disparities. Dr. Blanchard's work has been featured on both mainstream media outlets and academic medical journals, including National Public Radio, CNN, the Baltimore Sun, and The Hill. In addition to her research work, she continues to practice clinical medicine in the emergency department. So today, we had a really hard time deciding which paper because they were both so important and we couldn't decide. So she's going to highlight both of these papers. And I'd like to introduce Dr. Janice Blanchard. I will send around cookies to keep everybody awake.
I was wondering maybe before we start, if people could just tell me a little bit about, well, one, I'm wondering if people read the article. It's okay if you didn't. But maybe people could just, if we could just get introduced yourself or just share your area of research. I know quite a few people here, but if there's some people that know. So I'd love to hear like what your area of research is.
Sure. My name is Katie Donnelly. I'm a paramedic professional.
Okay.
I'm the medical director for our Youth Violence Intervention Program, which is our HVIP. And I also do accidental intervention as well.
Hi, good afternoon. I'm Nasima. I'm the quality specialist in the center.
Okay. And my name is Rebecca, and I'm the microbiology laboratory director at the George Washington University Hospital. And I'm also in the Department of Pathology. My research interests are usually research and development for novel.
And when you tell her what your project is in the scholars program, if you're a scholar.
Sure, yeah. So I am planning on looking at so our trauma system is set up so, as you know, the kids 15 to 17 don't go to a pediatric trauma center, they go to an adult trauma center. But I find that they often end up kind of back in the Children's National orbit because they follow the Children's National. So I'm looking to see if these kids have evidence of like more fracturing of care, more discontinuity of care, either by going to another hospital for their follow-up care, or having more evidence opposed to like inpatient care, pain, that sort of thing. To then see if we can tailor their intervention through their HVIP.
Yeah, Rebecca.
Yeah. So my project is to understand and to characterize pregnant women population that have the streptococcus. So we're trying to understand what allows these women to get tested or encourage them to get tested, as well as the positivity rate of the streptococcus in our patient population.
So Catalina, I'm Associate Dean for Clinical Public Health and Population Health Practice. And my main area of research will be their medical education or opioid use disorder. And I get some interesting about her project, which she'll tell you about later.
Hi, I'm Mary Warner. I'm the chair of the PA Studies Department, and I'm mentoring. But my areas of interest are PA education, medical education, and opioid use disorder and integrated behavior.
Hi, Emmeline Huff, family physician. I'm one of the scholars from last year, staying on for second year, and my project is increasing behavioral health services through primary care integration.
Hi, I'm Samantha, also a second year scholar. I'm an internist primary care physician, and my project is on using clinical decision supports to improve initiation of medications for opioid use disorder in the hospital.
Hi, I'm Laura Exmerton. I'm also a second year fellow. I'm a psychiatrist and also I work with James Griffiths, I think.
Oh, yeah.
my project is on implementing a low-grade psychological intervention called Problem Management Plus that's been developed by the WHO in DC by training social workers, case managers, also GW students and staff in this intervention so that they can deliver it to residents of Southeast DC.
Great. So I had it kind of, I was gonna share results, but I think since this is a health services research kind of forum, what I'll do is kind of share a little bit about my thought process and the methods. And then, I don't know, how many people actually read the paper? Did anyone read? Oh, you did. So I kind of will share more kind of the thought process and some of the methodologies, and then we can just stop in the middle or stop even earlier if you want, just have a discussion. Okay, does that sound good? Yep. So I am a health services researcher. I kind of started my career doing a lot of work with racial and disparities in access to care. I did a lot of stuff with DC, kind of looking at their needs assessment. I've also done a lot of mental health things, but this is kind of something that came out of a personal idea. So I can share this with you and we can talk about it, and just jump in if you have questions at any point. If it's not advancing, is there something?
Sometimes you have to click on the screen first. With the cursor, just like.
Okay, so yeah, again, like I said, we can kind of deviate from this roadmap whenever you guys want. So, and then these were kind of the people. So I'm going to talk a little bit about how our research idea is born at first. So you guys all remember COVID. It seems kind of like a distant kind of memory, but during COVID, I actually had just come back from Japan. My husband's in the military. He's actually deployed in Qatar now. And we had been in Japan for 3 years, and we came back, and he had to go to Djibouti, Africa for a year. So I literally came back thinking that I would probably die from COVID. I was coming home to this basement apartment, and my husband was overseas. And I realized that I had like PTSD. I mean, I came home and I would just be so depressed. I was like, what is this that I'm feeling? Some of you guys might have remembered Laura Green, who committed suicide, who spurred a lot of the work that we now see. But this happened during the whole time of COVID. And at that time, DC cases were super high. I remember going to the ER and just room after room. It was, you guys remember, it was just like COVID, older person from a nursing home. You knew that they probably would not make it out of the hospital. This was just a reminder. New York Times had this really interesting article. I don't know if any of you guys saw it. It was really telling. And we definitely didn't experience that level, but we experienced a lot. You remember, Neil, it was hard times. So I started writing. So I started writing all these op-eds. I'm not sure if I would write any op-eds nowadays with what's going on in the world in the US. I started doing a lot of op-ed writing and doing a lot of writing. But then I also realized that I was feeling something. I started wondering if other emergency medicine physicians were feeling it too. And I was like, this isn't right. We need to really figure out what's going on. So I don't know if any of you guys know Melissa McCarthy. She's a health services researcher. She retired, but she used to be at the School of Public Health. And I called her and I was like, Melissa, hey, there's a grant due in 10 days, an EMF grant. And we were gonna apply. And Melissa's brilliant. It's like, okay, let's do it. And there were like 78 people in some kind of way. Miraculously, in 10 days, we were able to write a research grant and get it. So basically, at the time, although I think a lot has come out where we've talked about stress, there's been tons of articles, but at the time, there really hadn't been a lot out there. People weren't really writing about this. We had the SARS pandemic and the MERS pandemic and a few pandemics before, but there wasn't a lot known about how pandemic-related stress affected healthcare workers. In emergency medicine, we already know, and it's been so many highlights since then. Like, fortunately, there's been a lot more focus on this, but it was kind of really started with COVID. That's when they really started talking about it. We already know that physicians and other frontline providers have a high risk of burnout, but it hadn't really been quantified extensively. So 10 days, how do you pull together a project? I'm curious if any of you had ideas like what you would do in 10 days. Like, what are some things if I, you know,
10 days before the grant is due or 10 days before I start going to your
I had
grant?
10 days to write it. So,
Okay, so you
I
have,
mean, but
yeah.
you know, you still have, what is it? Maybe you have, I don't know, it like maybe a week or so they had to get it in to the Office of Research. But 10 days to write the grant and to get the everybody. Any ideas? Have you, what
At
would you?
GW, I've learned that like the first thing you need to do is like contact the grant people.
Yeah,
Because if you start, at least my experience has been like, if you start the writing and all, like they have to know and they have to put you in the system and they will give you their own deadline,
exactly.
which is
The
like
thing is,
many
I
days
know, yeah.
before the grant. So you probably only have like 3 days, not
Exactly.
10.
Yeah.
So,
Yeah, I
yeah.
think it might have been 10 days and maybe we had like 7. So it was fast. Fortunately, my husband was overseas. I was in a basement apartment. I had like no life. So I would see, and then I was like, I have no life. I have to stop this. I have to stop working. But fortunately, I had no life, so I was able to do it. So first thing is contact someone at the research office. Okay, any other thoughts? Well, I'll tell you. I'll share with you. So that meant rapid mobilization. Fortunately, in the emergency medicine, we can move fast. One thing when you're trying to do a study, especially survey studies and even qualitative studies are super hard to get published. And single center survey studies are also super hard to get published. So we really knew that we had to make it a multi-center study, which is even a bigger challenge in today's. We also know that when you do a survey, you need validated questions, right? You can't just pull them out of your head. We also knew that mixed methods are always really nice. Are any of you guys mixed methods or qualitative? Yeah. So, it's really valuable. I am not a qualitative person. I've done it, but I'm not a big fan. I love data, but we knew that mixed methods would be really helpful. So we really thought about who we'd get. First of all, we were reaching out to people we knew. Let's face it. We were like, what do we know? So let's say you're trying to do and you read the paper, so maybe this is a rhetorical question, but when you're trying to do a multi-center study, you want people from diverse settings, right? So you're gonna write your list out and think about how you're gonna get them. So we wanted to get people that had different rates of COVID, right? We know that some places had a lot more restrictive kind of laws than other places. We knew that some people were a lot more against some of the restrictions and against the mask mandates. If you go back into your head, you remember all of the differences. So we wanted to make sure we could get people from all over the country from different places. And most importantly, we needed to know someone. So, I've found some fellows. Melissa is a great researcher, so she reached out to some people and we ended up with a really nice group, So if you look at this, these were, again, people we were able to reach out to. And you saw that we had a pretty diverse, if you looked at the cases at the time, it was a really big difference. Obviously, we wanted someone from New York. We wanted someone from New Orleans because they had, and Mount Sinai, the site we had was actually one of the epicenters that was featured in that New York Times article. So we had ended up with a really good group. So we wanted to get a diversity of cases. So you saw our goals and our aims. Basically, wanted to measure the impact of workplace conditions on EM provider well-being. We also wanted to see whether there are mediators and moderators that influence the relationship between working conditions and psychological well-being. So the first step when you do any research proposal, again, I am a numbers person. I always hate when they tell you you need to write a conceptual framework. I hate it so much. But Melissa's like, we got to write a conceptual framework. And she was right. So the first step with any research proposal is developing a conceptual framework. You want to think about what you're proposing, and you want to make it fit. You want to make it so that the person evaluating your proposal can actually visualize it. It makes it a lot easier to explain. So we proposed that job stress was a mediator between the work environment and adverse outcomes like anxiety and burnout. But we thought that certain things could moderate how stress impacted that development of burnout. Does everyone know the difference between a mediator and a moderator? And I'm gonna talk about that because I don't think I really knew either. So a mediator basically explains how or why an effect flow occurs. So it lies between your independent and independent variable. It's kind of like in the middle of that pathway. We all know that, so we thought that a lot of people were in these really stressful, in these horrible environments where they didn't have good PPE or the hospital wasn't supported. But some people would go in and become really depressed or anxious, but other people were fine. So we thought there was something that was going on in that pathway that would lead to that outcome. So a mediator is it goes in the middle of that. It's kind of in the middle of that pathway, and usually do things like bootstrapping. It's like a whole statistical approach when you're looking at a mediator. A moderator you guys are probably more familiar with. Have you guys done stats and like interaction terms and things like that? So a moderator is basically changes the strength or direction of that relationship. So it's not in that path from your cause and effect. It's actually just changing it. So let's say hypertension, maybe poverty and gender and race all work together to change whether you're going to get heart disease, right? That's an example of a moderator. So a moderator is something that might change the strength of that relationship. So this is what we came up with. We actually did this based on literature. We looked through the literature again in a week. And we kind of found a couple of models. It's always great when you have your conceptual models based on what's published in the literature. And we adjusted that. And what we thought is that job stress was the mediator. You have these workplace conditions, and then job stress is what's in that pathway for whether you're going to get anxiety, PTSD, or burnout. I mean, we know when we have a stressful day, if you have a stressful day at the clinic, probably you might get more burned out versus if you're at a place where you see 2 patients at the clinic, right? And then we thought that your moderators, the things that would change how this effect would lead to anxiety or burnout, were things like your coping behaviors, your support, things like your age, your marital status. Maybe you had a supportive partner at home. Are you a caregiver? You know, if you have an elderly parent, you're going to really be a lot more stressed about bringing COVID home, you know, if you have a child or an elderly parent. So this was the conceptual framework that we developed. And please, if you have questions, just jump in. Does that sound pretty clear? Yeah.
I guess my question is, whenever I'm looking at, like, I'm trying to develop a conceptual framework, is like, why is mine the right framework?
Yeah.
Right? Like, what am I missing? Like, why is like, or I'm trying to like look in the literature and like, there's other people's frameworks. They haven't really, like, how do you know when you're done? Right.
Yeah.
And maybe you're never done and you just have to accept best case.
Well, I think what you're doing is when you're writing a grant, you're making an argument of why you need to test your conceptual framework. You probably shouldn't come up with one de novo. You probably should. So we found 2 frameworks in the literature. We adjusted it and we just explained it. And I probably should, I mean, I'm happy to share my grant application, but you have to explain why you think your framework makes sense. But I think should be based on the literature, right? And then you're writing that you're trying to prove. So our outcomes were this anxiety and depression. And we thought that it was workplace conditions that was kind of our independent variable. So we were trying to prove that your work, you know, most people were talking about stress and anxiety, and they're like, go and relax, and you need a program to do meditation at work. But nobody was talking about the fact that it's like now they started, but still nobody talks about how horrible the environment is that we work. They're like, oh, it's always kind of in the hands of the person, the caregiver. You need to go and do a yoga, and you need to come in on your day off and do yoga. You know, you're like, oh, but nobody really was talking about it. So usually when you have a framework, it should be kind of based on literature. And what your job is when you're writing that grant or when you're writing your paper, you're explaining why you came up with the framework and why your model is the best way to prove it. Does that make sense? But I think they're weird. I was never a conceptual person.
Do you have any tips for how, especially with the compressed time you have, but even just general, like when you're looking through the literature for frameworks that you can use? Did you like include the word framework or include the word model as part of your?
I'll rather research.
Kind of do.
I can't remember how we did it. There's one guy who had done a lot of stuff. We looked at like some of the previous pandemic work, and then what we actually focused a lot on were things that looked at job stress. which isn't natural, because you're thinking, oh, I'm gonna look up prior pandemics, I'm gonna look up the effective, but we looked up job stress. So, and even sometimes you might have to go outside of the medical literature. So we kind of focused on, we looked at OSHA stuff and all stuff that looked at work environment stuff. So I don't remember the exact lit search that we did, but I think we were looking at more job conditions, because that was what we were thinking. We were like, something is, and this was before people were talking about moral injury. I mean, yeah, so that's kind of where we started.
So what I'm hearing you say is that for most people, if you have a research question or a study that you want to do, you have to have some kind of idea of what you think is in this pathway.
I
And
think,
so
yeah.
like your literature review is informing this pathway. Like, you know, when you were like, where do you get started? You're not just sitting there waiting for an idea to fall out of the sky. You've already decided. I think that
Yeah.
job stress is causing people to have poor mental health, right? And then you start writing it down and you're like, well, why? It's, well, their jobs suck. It's the workplace conditions. And then you start doing your literature search around that and if other frameworks exist, et cetera. Like none of this stuff sort of exists in a vacuum, importantly for people. And to Katie's question, some of these things, they can go on and on and on and on forever, which is, I think, a trap I fall in. I was just like, okay, stop. But what are you going to hypothesize around now? Like, what is the immediate hypothesis
Yeah.
for this particular framework? And then maybe you build on it later once you've tested that hypothesis and then go from there.
Yeah, I think that's exactly right. Yeah. So Katie, it's Katie, right?
Mhm.
You'll start with your idea, like she mentioned, you'll start with your idea. And it doesn't have to be a perfect idea, but you have an idea of, I mean, you work with kids and trauma. So you have an idea of what things based on your personal experience. But then you're gonna try to find something to help back that up. But I do think it's really helpful when you're doing a grant to kind of start with that framework to help you. It helps you kind of explain kind of what you're trying to do, and it helps explain your model a lot, especially with qualitative research, I think, which again, I'm not a qualitative research fan, but you got to have a conceptual framework for qualitative research. I don't know. Have any of you guys done a lot or published a lot of qualitative research? Yeah, but usually you do need a conceptual framework. With quantitative stuff, you might be able to get away without putting that, but I think it helps for both. Any other questions?
Which is because CFE just did that talk, was it 2 weeks ago, about why grants get rejected? I don't know if anyone knows, besides me, and it was a person from the NIH, and she totally said, have a conceptual framework and describe that to the folks who are reviewing your grant. So
Yeah.
just to echo exactly what you just said.
Yeah, and Melissa, who is retired now, is brilliant. I mean, it was really helpful working with her.
There is an online, it's called Med Ed Mentor. That does have a list of a lot of theoretical frameworks that you can use. I'll just look it up and tell you what the website is, just 1 minute.
Yeah, I think you can maybe use that site to help you figure out how to lay it out. But then you also want to have kind of, this was my outcome, this was my main independent variable. Kind of, you're gonna, maybe in the 2 boxes, if you're starting your framework, maybe start with that cause and effect, what you're trying to improve, and then start kind of building around it. You know, these were our control variables, right? These are all in things that we ended up, this is really just a statistical model in a little graph, right? So, okay. So these were the sites. We had the 10 sites. We had this qualitative portion and then the survey portion. So kind of curious, how do you guys come up with your kind of sample sizes? And I can tell you how I came up with mine. It's much more basic. It's not like really fancy.
Qualitative always feels like,
Yeah.
Your sentence in there that's like, we will, continue to monitor their data until thematic saturation is reached.
Yeah, exactly. So for qualitative studies, it depends. If you're trying to just kind of wing it, you can do it until you get saturation. Obviously if it's, quantitative, you can do a power analysis. You look at prior studies, you look at the expected differences, and there are a lot of different calculators and you can figure that out. But guess what we did it? We did it based on money. This was a tiny grant. It was $35,000, which is nothing. So we were like, what can we afford? And that's kind of how we did it. We wanted to be able to pay, I think we gave each of the site people $1,000 each. So now you're talking about $25,000. So you can imagine that I did a lot of free work, right? So what we did is we had a qualitative portion. And I'm going to talk a little bit about sampling and then a survey portion. Our interviews, we did 45-minute interviews on Zoom by Melissa and I, and they were really powerful interviews. I mean, there were people in tears in our interviews. We had an EMS, an attending resident, a nurse from each of our 10 sites. We incentivized them. We gave them $100 because, you know, you have to pay people for your time. I don't think that's considered coercive when in that population. You know, they probably make $100 an hour. So we wanted to be thoughtful about people's time. And I think when you're trying to get people that are busy, and you know, physicians have a high non-response rate, you need to give them an incentive. So what was this? Basically, we chose people on purpose. It's different from convenience sample, though it's kind of a convenience sample, but basically you're choosing people because you think they might share a variety of ideas. So we wanted to make sure we got some racial, you know, a lot of richness in terms of racial, gender, and where people were from. So, and it was really good the way we did it. So it's a little different from a convenience sample. But again, it's not representative, right? So obviously we have those problems in terms of limitations. And it's fine to do that as long as you acknowledge your limitations in your grant and in your paper, and you show people that you're thinking about them. And this is pretty common in qualitative research. So we did a semi-structured interview. We looked at things, place conditions, stressors, mental and physical wellness, moderators of stress at the workplace, at home. We used in vivo, you guys, if you read the paper. So we sat with Dr. Griffith, Melissa and I, we did like 2 pilots and we came up with a code book. And then we took those codes and we went through and we mapped it. So we used in vivo. I think you can actually now do it even with ChatGPT. I hear people are starting to use. Has anyone used ChatGPT? I think you can actually even do qualitative research with a lot of different things now, but I haven't used it, but we used in vivo.
Do you worry that ChatGPT is just gonna suck up all that data and then all your responses are just gonna be?
It could. Well, yeah, I didn't use ChatGPT.
Yeah.
I think that is a real issue. I bet you Chat's gonna come up with something that's gonna be protective, because when you do have to make sure you protect their data. I mean, you could argue though, if you take their names out, how would ChatGPT know?
I mean, I think it would be hard to like identify, but then they just have all of this.
Yeah, but without names,
Yeah.
they probably have all your emails anyway. They probably are all in your computer. I don't know, Neil, what do you think? Have you used ChatGPT for research? Yeah.
Because I worry about the privacy.
Yeah, but if you don't have their names, you could argue you could. I have not, this isn't a talk about, you guys should have a ChatGPT research.
Yeah.
I am not a ChatGPT researcher. We used in vivo. So what do you guys think are some components of a good survey? Anybody? Some of you guys working on surveys for your project? What do you think are some good components of it?
Validated survey questions.
Exactly, validated. Anything else?
Length.
Length. Yep. Anything else? Have any of you guys fielded your surveys yet, or are you kind of still working on it?
I finished mine, yeah, I think it was good to at least have, Dr. Warner was good about bringing up, but have a pilot group to kind of dispense the survey and see what their thoughts were and how long it took for them to finish it before we send it out to our actual sample population.
Exactly. So this is the one time where it's good to plagiarize and use other people's information. So you really should do validate it. It needs to have been tested. And this is okay when it's okay to take things, is when you're doing survey questions. And as she said, it has to be short. No, otherwise after 2 minutes, you're like, oh. You should incentivize people when you can. You really should try to pay if you have the funds. It shouldn't be repetitive. You really want to think about the questions you're asking. And if there's a way to measure something in a short way, use the shortest way. Anonymous. And then, again, like you said, a pilot test. It should always be validated. Every once in a while, there'll be some questions you just can't validate. we ended up pulling questions from the OSHA and just the most random places. So, but if it's been tested, especially in a large sample, that's going to make it a lot easier for you to get it published.
This is something that I've struggled with sometimes, is sort of this validation question, because I often, you can find surveys that are asking questions that are very similar, but not exactly the same. And then I guess I know you want the questions to have been validated as much as possible, but is it important that the questions are validated sort of like as that particular set of questions in that order? Because you could be pulling from a variety of different surveys that have all been validated themselves. But I feel like when I talk to real qualitative research, sort of like gurus, they get very bogged down by the validation, and it just like holds me back
Well,
sometimes.
the whole survey doesn't have to.
It's a
I'm sorry.
oh,
I'm sorry. Go ahead. Go ahead.
There's a difference between a validated tool and a validated question.
Yes. Exactly. It's exactly what I was gonna say. It's exactly. The whole tool doesn't have to be. It's the questions need to
question,
be
right.
validated. And I mean, when you have a question, you probably shouldn't change it if it's been validated. But
Yeah,
if you do have something, you just have to come. We maybe had a couple, but not more than a couple at most. I mean, you could get the census for your demographics. There are a lot of places to get your questions, but the whole tool doesn't have to, unless it's a tool that's measuring a specific thing and you need it all together.
yeah.
And when you don't, then you can always pilot if you're coming up with a new, but it's so much involvement in coming up with questions, especially like Likert scores
It's a
and
lot, yeah.
psychometrics. It's just a lot. So it's just better to plagiarize that one. So again, ours was 15 minutes long. We gave them $10. We asked about demographics. We asked about stress, home support, and then we used validated questions. So we were able to, again, you also want it randomized. So what we did for the residents, and again, this is in the paper, for the nurses, residents, and doctors, we actually, our site, people gave us a list of everyone's email addresses. And then we had this really brilliant statistician who's gone, but she chose them by random, and we sent an email. You always want to when you can, not do a convenience sample for your surveys. For an EMS provider, you can imagine it was just too hard. So that one was kind of it was supposed to be kind of a random, but we just gave flyers out and asked people to fill it out. And we didn't, now you can do QR codes. I think we did QR codes, so it would be easy.
And I noticed in the paper, you guys did acknowledge the limitation of that, which is
Yeah.
you can't say what the response rate is if you don't know the denominator.
Right.
Yeah, so we did not
You
report it
mentioned
from
that for
them.
the EMS.
Yeah, we didn't report it from, but I mean, it's okay when you have an imperfect thing, as long as you acknowledge that it's imperfect and you acknowledge that ahead of time. That's how you get when you're doing something. We just could not think of a way around it. So these are some of the questions. I won't go through this because you guys all have the paper, but as you can see, we got a lot of things. So some of the validated questions we used from this guy Monders had published a couple of papers on SARS and MERS. So we just actually got his the tool from his paper and used some of those questions. So you can get them from a lot of different places. We use the census. We use a lot of different places. And then for mental health outcomes, there are a lot of burnout questions, but we wanted I'll talk about this in a minute. We use the PHQ-4, we use a physician work-life study. And then we looked at the mediators and the moderators we used from this one paper. So there are a lot of depression scales, but you always want to use the shortest. So we use the PHQ-4, which is just 4 questions. There are lots of burnout. Obviously, there are some really wonderful burnout skills. The perfect is the enemy of the good. We found the single item scale. Obviously, maybe it's not perfect, but it actually was pretty good. And then we had a job stress scale that we used. So we used brief scales so we could limit the question burden while still getting all the information. So this is a PHQ-4. I don't know if any of you guys have used it. You're in psych, maybe you're like, this is a terrible scale, but Dr. Griffith thought it was okay. We did have a psychiatrist. It's also important on your team to have people with good expertise. And I think that really helped our grant too. So I don't know how you feel about this scale, but
Okay, as long as people don't use it to actually diagnose.
yeah, it was for research. Yeah, it was for research. PHU9's a little better. This was the burnout. I feel burned out from my work. It's nice, short. Yes, I am burned out. And then this was the job stress scale that we use, and this one. So I just want to talk a little bit about latent class analysis, and then if you guys wanted to talk, because I thought it was something I hadn't used before, but it was actually a really cool tool. So we used something called latent class analysis. We also did, in every research study, you're going to do your univariate and your multivariate analysis. Our principal outcomes were depression, anxiety, and burnout. And basically, we thought job stress was a mediator. Basically, this question that Murata had was about how much stress you have. Like, I don't know, yesterday I had a lot of job stress, but we know that a lot of different things can contribute to that job stress. So has anyone seen latent class analysis? No, it was like super, we had this smart, and I probably still can't explain it well. I'm going to try to explain latent class in my description, but fortunately our statistician was super smart. So get a really smart, amazing statistician on your team. So basically what it does is you get these surveys, and you probably going to try, when you're writing the proposal, you're like, I'm going to ask about this, I'm going to ask about that. But when you're actually doing the analysis for your paper, you can only use so much, right? Nobody wants to see every single survey question that you asked about. Your paper would be like 50 pages long. I mean, you want to use that data. So this is a really cool way to take your data, and it groups into buckets to make similar groups. It's kind of like this is some special thing that they do in Stata. It's a good way to identify unobserved subgroups, because you might think you know how people fall into buckets, but you don't always know that. So this actually takes those survey questions and it looks at similar response patterns. Hopefully but it's something really cool that I would suggest that you maybe look into. And Melissa had used that for another paper too. So basically, this is kind of just. So we ended up doing 32 qualitative interviews. Our pilots we didn't change our questions, so we just used those. And then we had a 77% response rate for our physicians, nurses, and our residents, which is actually really good. So money matters. We gave them $10, but $10.
I have a question about that. So, and it's very technical, but I think it's helpful for some of them and us who do surveys. And I was like, 75% response rate, ooh, they shooting high. Because some surveys that you do, especially population level surveys, sometimes you're like, if you get a 30% response rate, you're doing wonderful.
Yeah.
So initially at one point in the paper, you talk about trying to survey 650 people. And then if they don't respond to 5 attempts, then you send it out to another group of people at that same institution. And so there were 800 and some odd people who were surveyed or something. Now, all of a sudden there's 701 surveys completed, but the initial target was 650. So I'm trying to work out what is the 77% response rate calculated on? Right. So, but I think this is important because
Maybe the 800.
Right. It's important because when you think about some of these different survey methodologies, like you all did purposeful sampling, you had a list. Some qualitative methods, they will use snowballing, like we're going to start with this list of 10 people. And then at the end of the survey, do you recommend it?
Yeah, I don't, do not use
snowballing. I had a doctoral student who just did snowballing.
Oh, yeah.
But it was necessary for their studies that it was like COVID related as well. And people have moved on. You don't even know who works where, but you got to find some people. So, but I think it is instructive because if you initially have a target number of people and you say we have this finite list of 650, but if they don't respond, then we have to send something back out. Are those non-responses part of that response rate or okay?
We didn't actually replace and I can't remember the details. I think we did accounted for like a 10% loss. I think we oversampled, so we sent to more than 650.
Okay.
And RedCap is super cool because they have this, I haven't used RedCap in a while, but they have a way that you can see who responds and you can put every 7 days, send a reminder email. So they'll send out the email automatically. Do you guys use RedCap?
Yep.
It's really great.
Yeah,
They'll tell you how many times, they'll tell you. We did replaced mainly with the qualitative studies.
Okay.
Yeah, I think we just I thought we just but I put in there, I don't know, did I say I replaced? I can't remember.
Yeah, it says
You did say that you would
50.
like sample another X number of
An
people.
X number of
Just
people
curious.
who did not respond after 5 attempts.
Yeah, maybe
So
we did, but it wasn't a
mention the
lot.
former sampling. Okay.
Yeah,
okay.
I'm sorry, I should have reread this, but, but when you do your response rate, it should be based on the total.
Total number, yeah.
Yeah, it was the total. So if you did do it, maybe it was just 50, which still is not bad, but it has to be the total. Yeah. I don't think snowballing is the best thing. Obviously, if you have to, I think it's gonna be harder to get your paper accepted when you do snowballing. Yeah. And I do think you want 50% response rate, you know what I mean? And obviously you want to talk about the people who didn't respond, however they were different. I honestly can't remember. I guess I should have looked through all of that, but I don't know, I blocked it out of my brain, but we didn't replace a lot of people. Yeah. Do you have any other questions?
Oh, that was it.
No?
No.
That's a great question.
I just have my prompts.
No,
It's very vague.
I don't remember. I'll have to go back there.
When you mentioned that snowball sampling is frowned upon right now for papers, is that because it's a little too much like convenience sampling and you're really
Well-
getting a bias of people who are getting chosen?
Yeah, so you guys, it's biased, right? It's
Right,
gonna
yeah.
be a bias. Yeah, that's why doing it randomized. You know, that's why we ended up getting the list and let someone else pick it. Cause you don't, if you snowball, you'll get people that think like you and you're gonna get people that all think very similar. So, and that's why that EMS thing was biased, obviously giving people flyers out. So, but even like, yeah, but we did use the total number. I just can't remember exactly. I think we must have had to replace some. And you know what I think happened why we had more is because when we replaced, then the other person that we initially had ended up responding. So that's how we had it. So this is what it looked like. This looks really cool. It's like good to have this in your paper, but this is what your radar chart looks like. And I'm just gonna talk about the groups and then maybe we can just stop and see if people have any other questions. I don't wanna just bore you guys. These were the groups and how they fell out. And these again were based on the survey responses. So one had a good work environment except for some administrative support issues, and that was 40% of people. So these are people that less than 10% of them had a poor physical environment, inadequate training, or insufficient PPE. They had satisfaction with all aspects of the organizational support, and they were satisfied with the social support of their colleagues and their supervisor. They didn't feel that the workplace, but they did not feel that the workplace made their work easier. So they had a little bit of negative, but otherwise they felt like their colleagues were really supportive. And then there was the next group, which is risk group 2. They had inadequate resources, but they were like, hey, we still have really good work support. So they said they had a poor physical environment. They didn't have easy access to COVID testing, and they weren't adequately protected from COVID compared to participants in risk group 1. But they were generally satisfied with organization and social support, except for the administrative support. And most people thought their employer took their well-being into account, and they were most satisfied with the support they received from their supervisor and colleagues. Then there was group 3, that was 18% of the sample. So most of them thought they had adequate physical environment and training and PPE, more than group 2. But they didn't feel appreciated by their employer. They didn't feel that their workplace was supportive, and they were more likely to report a decrease in pay and benefits. And then there was the group that had a really bad work environment. Basically, they had poor physical environment, inadequate training, poor protective equipment. They felt inadequately protected. They felt unappreciative. They thought their workplace was unsupportive, and they stated their organization didn't have support resources. So as you can imagine, we kind of used the group 1. As you can imagine, you know, this was just just a graph looking at that. I can stop here if you guys want, but as you can imagine, that group had the most anxiety.
So these risk groups, is that how you use the latent class analysis?
Yeah, so the latent class analysis kind of put all of the data, and then there's some kind of program you run, I don't know the state of code, and they run a latent class analysis, and they actually will give you the groups. And this is how our groups fell out. So it's a really nice way when you have a lot of data to make sense of the data. Again, you need a really smart statistician to do it, which we had.
Question, did any, these different groups associate with like where the burden of COVID was the highest? Cause I remember like, even at Children's National where like, we didn't have nearly as many kids as adults, but I felt pretty grumpy about my lack of PPE, as well. So I was curious, but I guess it also probably doesn't matter because you're looking at the perceived.
No, it did, and actually we had a control for the rate of COVID and for the days since the first the outbreak, and actually the rate wasn't associated with the anxiety.
Hmm.
Yeah, it was independent.
So it was totally how you perceived
It was
your
perceived, and that's
hospital support, yeah.
and that's why we had a mediator, right? So it could be really bad where you are, but depends, what's your perception, what's your job stress. That's why you had that mediator in there. Does that make sense?
Yeah.
So I think we're almost out of time, but if you guys can look through the paper to see this, but basically what you would expect, the people that had the most job stress were the people in the poorest work environment. And we actually did find that when we talk about mediators and moderators, we actually found that your perceived stress did mediate burnout and anxiety. Partially mediated burnout and completely mediated whether you get anxiety or depression. So I'm gonna stop there. I don't know if you guys have questions or I have more slides. I can go forever, but
I have a question for you. And can you share with us a little bit about your role as the researcher, but also the person conducting the interviews? Qualitative study and with both of you as co-PI splitting the interviews and what that does to fidelity to the study and all of those things. I know in the manuscript you all talked about the two sort of ways that you would prompt, or the language you use to prompt people to elaborate, but how that usually gets addressed in the study when the PIs are the ones actually doing interviews versus having multiple people do interviews.
Yeah, it's always best when you have less people. So because you don't have as much variation. So if you can have less people, if one person can do it, it's good because you don't have variation on how the questions are read. I couldn't really interview people from GW, so Melissa interviewed the people from GW. We kind of did it 50-50. When you can, I mean, I think we did a Kappa statistic just when we looked at agreement when we were just doing how we coded it. In terms of agreement on how you interview, I don't know how you could do that. I mean, I guess you could do a pilot and have two people. Yeah, I don't know how you do that. That's just gonna be a limitation, but if you have an interview and you have less people, I think is that answer? Is that what you're
Yeah,
asking?
and then like also as the PI doing the interviewing, like how does that?
Right, versus asking like
Right.
for the independent.
Bias, yeah. Well, it's also better if you have the money to have someone else do it.
Yeah.
Obviously, we had a research assistant that did the transcriptions. You probably could chat do that now, whatever. But we had a research assistant, definitely. But we tried to stick to a semi-structured interview, and we didn't. I mean, I think it's an art to it, like to learning how to interview, and where you're not like, oh my goodness, like you don't want to react to it.
Yeah.
And both of us had done enough interviews that we knew, and it was recorded, so the other person could actually listen to it. And again, I'm sure a qualitative researcher might have a better answer for you than that. But what we did is that we just had enough experience in doing it, and we kept it to just two people. If you have a lot of money, you can get an independent person, but you have to train them and make sure they know how to interview. Like if you have a college student and they don't know how to interview someone, you don't want to have prompts I mean, there was a guy who was crying in my interview, and oh my God, it was just, I mean, that's the other thing, when you're doing something that's emotionally triggering, you have to, in order to get it through IRB, offer some kind of resources, which we did. So at the end of every interview, we would give people resources and make sure that they had that. But no, I think it's just training. If you can get an independent person and you have the money, that's great.
So I think that's really important because we hear a lot, in this environment where we want to do team-based science and you lifted up, you can explain latent class analysis, but you surely don't want to be the person doing it as a physician, health services researcher, right? Get a great statistician. So having the team be in interdisciplinary or multidisciplinary teams, but we also think about how we have this responsibility as academic health center to have people at various levels of their training on the team. And so what we allow the learners and students to do or the postdocs to do, we have to have a level of responsibility around. You know, if it's a quantitative survey that we're having them administer and the person is essentially self-answering responses in a clinic on a tablet, that's very different than doing a qualitative study where you're actually interviewing and the people are responding and it's recorded and you have to be able to ask follow-up questions in a semi-structured way. So just something to think about, because I have heard with talking to faculty and junior faculty, well, we're going to use the students to help us with our survey. And sometimes I get very, very nervous because there's a degree of experience that is required to have people involved in the study at certain levels. So thank you for sharing.
Oh, sorry, go ahead.
Thank you for sharing that.
I was just gonna say, to add on to that, I had a very experienced interviewer who was a market researcher try to ask questions in a study that I was doing. And so I already knew she knew how to do it. She'd been doing it for 30 years. I gave her the questions, we talked about it, we practiced a few of the questions and so on. And what she got back was garbage in, garbage out. Unfortunately, she was like, I'm not getting any answers from these questions and I don't know what to do. And I was like, I thought you're the expert here. Actually, I'm not, but she has focused on market research. And I bring that up because if you run into someone who's very well qualified and they mention to you they're market researchers, you can do what you want, but I would personally run the other direction because it did not work at all. And she realized that she was frustrated by it because she said, I'm not getting what I know you are looking for. And I don't think it's the questions. I think it's the way I'm asking them. And I'm like, yeah, I guess so.
So I have used students and I think they're still really valuable. You just have to train them and probably have a period where you're observing them. But the other thing, semi-structured, the whole point of semi-structured interviews, I'm thinking when you talked about it, you should have prompts. So you give people an opportunity to just go free flow, but then you have little prompts. So a really good interview protocol has a couple of prompts, if blah, 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 to help kind of guide you. And you want to make it detailed enough. You want it open and ended enough to get rich information, but you want it detailed enough that it's not going to go off on some weird tangent and go forever. So, and I'm happy to share some of that. I mean, when I do stuff with the brand for the city, we would do a lot of semi-structured interviews. So,
I did a few interviews and I did with a medical student, and the first interview we did together so she could kind of see how I was doing it. And then she did a few on her own, but it was interesting because I felt like I was really conducting a psychiatric interview where you kind of you want to build rapport, make the person feel comfortable, heard, and then you have specific questions you have in mind, but then you want to keep it open-ended enough so that they can develop and sometimes more closed-ended. And to me, it really felt like just a normal consultation.
Yeah.
I don't know if that helps anyone, but I actually felt like that's how you kind of get rich information. And it's kind of,
you're probably a master interviewer, right?
I don't know, but it's.
And when you think about your interview, you can always do a pre-survey. So you don't need to ask, hey, what's your age and race? So I think we probably sent that beforehand. I can't remember. But you don't want to ask close-ended questions. Anything that's that close-ended, you should do as a pre-survey. So that way you have time. Yeah. But I'm sure you're really great at interviewing.
Well, it just felt very natural. You go from open-ended, more then closed-ended, probing a little bit more. And did you mean this? And I don't know, kind of conversation.
So I heard it. But I think you're right about team science. When grants money is limited, so you don't need duplicates. I mean, as much as you like your colleague and they might need funding, think about who's on your team. You want a good statistician. We had a psychiatrist, Melissa's PhD health services researcher, and she needed I'm an EMED, and then our site people were EMEDs. You can pay your site people less. We had a medical student who did all of our data collection, and actually we send out for our transcription, but we had a medical student RA who kept. I actually had someone transcribe it. They're professional transcribers actually, but she's the one who kept kind of track of it. And like, we had people, they had to give us their information at the end. I forgot how we separated out in order to give them their $10. So.
I'm just gonna put in a plug for the, kind of as you three were all saying, of observing the students. If you're going to use a student, or even if it's not a student to do it. So I don't know how you here know Irene Coe from the School of Public Health, but I worked with her on a research study. And she literally made our research assistant walk through like painstakingly, they had to consent me.
Oh, yeah,
And she had to walk, and this is a long consent project. And at first I thought like, oh my gosh, she's so much more rigid than me. I can't believe she's like making someone do it. But it, like, we found so many things that the person really had to think about how they were gonna approach that and what they would say, what were okay parts to certain people, person, et cetera. And it was really, it was eye-opening for me because I felt a little uncomfortable with like that close level of supervision. And it was completely her norm and she didn't feel uncomfortable at all. And it was really, I think, quite appropriate because it got us to a much better consent process. And then fast forward months later, my husband broke his wrist. He was seen here in our ortho clinic and he participated in a PT survey. And the PT survey was closed answer direct survey questions where the students were just reading them. But clearly no one had ever observed the students reading them. And I had to bite my tongue every time because they were doing a terrible job administering the survey. Like I wanted to reach out to the PI and be like, you should throw away my.
What did they do?
This was not.
What did they do?
It really like what they should have done was like read the question, read the Likert scale, and you choose. Read the question, read the Likert scale, right? Like actually go through. But they in some cases like even paraphrased the question, which I was like, oh, I can't believe something. But then more often like didn't actually express the Likert scale.
Right.
And just sort of gave like a rough idea or assumed you remembered it from last time or et cetera. And so there were like, even if you questioned, like my husband would answer, I'd be like, you sure about that answer? You know, like, I was like, oh, the answer you've been saying, oh, like everything that answer. But anyway, just it was clear to me that no one had observed those students and it was a very straightforward survey. But I was uncomfortable watching, like I'm not sure that data is actually as good as that should be.
But that might be helpful for actually the person completing it, actually having the version in front of them and the question they're being asked.
Have the Likert scale in front.
That would have
Right.
definitely helped, especially for someone who is like highly literate, right, which my husband
Yeah,
just read it,
yeah.
because then they've been allowed.
When I do ADHD scales, that they're kind of long, the ASR.
You like give it to them too.
I give it to them because I know even their focus might be.
Yeah. Yeah.
Look at it and I read it on my end.
I think that's completely right, and this was like on an iPad that only that student was reading.
Yeah.
So you just had the visual, the like verbal part, but anyway, it just reminded me of what you guys all had said, right? I had this moment, having just witnessed Irene do this so wonderfully and thoroughly, to then be like, ooh, someone should have done that to this person because this data is not good anymore. And it was a validated, tool that they used.
It's an hour, right?
Yeah.
Oh, I'm sorry if I didn't remember details. Like I said, I'm actually happy to, I think the survey instruments on the back. I'm happy to share my grant application. I'm happy to share the, there's like some specific language when you're writing qualitative grant too, how you analyze it. That, I'm happy. And for Anita, I don't, Anita Chandra from RAND. She's a big qualitative researcher. So I just kind of stole the language we used at RAND. So there's some specific things when you're writing a grant that you put in there, like how you're analyzing it with qualitative data. So I'm happy to share any of that stuff with you guys. I don't mind.
So the resource I was talking about, which allows you to look at different theories in medical education research, which doesn't apply to everything. It's called mededmentor, all one word.org. And you have to sign in with your email address, but at this point it's free. And essentially you can both look at different, if you write a sentence about what do you think this is about, they'll say, oh, have you thought of this theory or this theory? And then it'll take you to the theory, you read the theory and go, oh yeah, that sounds like the one. And then it also includes some articles that use the theory. So you can double check that what you're understanding about the theory is useful. I don't think they have theoretical frameworks per se, but the theories for medical education might be a useful tool.
Yeah, just to see how it works and how to kind of do it,
Thank you, Dr.
Okay.
We're gonna keep meeting on the fourth Wednesday of each month. Next month is gonna be the third. It's November 19th because you have the holiday. Same time, same place. Thank you.
Thanks, guys.